Can my eyes look better with PRP treatment?
Platelet-rich plasma, or PRP, has received a lot of attention in the past few years in the medical community. I find this more than a little amusing since I first started administering PRP to improve skin quality for my patients in the early 2000s, and the same dermatologists and plastic surgeons offering the services now, many were openly discrediting the value of PRP at that time in spite of its established success in oral and orthopedic surgery, as well as for aesthetics in other countries. Of course, the pendulum has now swung in the opposite direction. The aggressive marketing of PRP has created a perception for many in the general public that it's a panacea for any problem with the eyelids, including hooded eyes, under-eye bags, hollow eyes, and dark under-eye circles. So I'll discuss what PRP can and cannot do for your eyes and what I do for my patients in my practice. I'm Dr. Amiya Prasad, and I'm a diplomate of the American Board of Cosmetic Surgery and a fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice for over 25 years in New York City and Long Island. I specialize in cosmetic eyelid surgery as well as non-surgical treatments for the eyelids and the eye area, which includes administering PRP for eyelid skin rejuvenation. As I mentioned earlier, I was one of the early adopters of PRP in the cosmetic medical field for skin rejuvenation, surgical healing, and as a component for hair loss treatment. This means that I have a perspective based on many years of personal experience on what PRP can and cannot do. So what exactly is PRP? PRP is a concentration of the wound healing and growth factors present in the blood which are activated when there is an injury, such as a simple cut. PRP preparation starts with a routine blood draw, followed by spinning the blood in a centrifuge to concentrate the platelets in the serum. In the early years of using PRP in my practice, an opportunity to discover the benefits of PRP around the eyes had arisen when a patient of mine who was a middle-aged woman of Middle Eastern background expressed a concern about having under-eye dark circles. Recognizing that she wasn't a good candidate for laser treatments, I offered her PRP to see if there would be any benefit. Up to this point, there were essentially no options for under-eye dark circles related to skin quality for people with olive-toned skin or darker. We saw her again in follow-up 2 weeks later, and she was delighted with the improvement in the skin quality under her eyes. At this point, I knew we were onto something, and as they say, the rest is history. The mechanism of this improvement is likely to be due to the induction of collagen production and new blood vessel formation, which occurs when there is an injury after platelets are activated. Collagen is a protein that provides structure to the skin, giving it strength and elasticity. You lose about 1% of the collagen in your skin every year as part of the normal aging process, starting around age 25. This percentage of loss is even greater when there are stressors to the skin, such as excessive sun exposure, smoking, and other toxin exposures. When you consider the mechanism of treatments like microneedling, laser, and radiofrequency application is to create a controlled injury in order to stimulate collagen production, it makes sense to combine these treatments with PRP to further enhance the intended benefits of these technologies. So for example, I use PRP routinely after performing fractional CO2 laser under the eyes so the skin heals faster and looks healthier after healing is completed. People often ask if PRP can treat eye bags instead of surgery, or if PRP can treat under-eye hollowness as an alternative to cosmetic fillers. It's important to first understand the basis for these particular issues. Under-eye bags that are present all the time are caused by prolapsed orbital fat, or fat that's normally around the eye, which has herniated forward. Herniated fat cannot be reduced with PRP. The options for improving the appearance of under-eye bags include surgery, such as what we do, transconjunctival blepharoplasty, or camouflage with under-eye filler, depending on the degree of the fat herniation. As far as hollowness is concerned, it's common to see the coexistence of lower eyelid fat prolapse with under-eye hollowness. So whether there is lower eyelid fat prolapse or not, under-eye hollowness is caused by a relative deficiency in the bone structure. Very often, the focus is on an area called the tear trough. The volume deficiency requires a material that has substance and viscosity, such as a hyaluronic acid filler. This filler material can provide volume, and at the same time, I can use PRP to improve the overlying skin quality. There is this well-established evidence in the medical literature of a synergistic effect when PRP and hyaluronic acid is combined. I'm also often asked if PRP can be used to help people who have upper eyelid skin redundancy, also known as dermatochalasis. PRP can improve upper eyelid skin quality to treat wrinkles, sun damage, and discoloration, but it cannot provide a lifting or tightening effect to significantly change the appearance of hooded eyes. In order to treat hooded upper eyelids, I typically perform a procedure called upper eyelid blepharoplasty. I routinely use PRP to help people improve the appearance of their fine lines and wrinkles. For example, I use PRP in combination with neurotoxin in the area of crow's feet lines. Crow's feet lines result due to creasing from repeated contraction of muscles around the eyes. A neurotoxin like Botox, Jeuveau, or Dysport reduce muscle activity, thereby reducing the depth of the creases, while PRP can be used to stimulate collagen and improve the appearance of these lines from within the skin. PRP is a very effective option to help improve eyelid skin quality, texture, particularly when combined with other procedures such as fractional CO2 laser. If you have under-eye bags or hollows, then other procedures such as blepharoplasty and hyaluronic acid fillers can be further enhanced with the use of PRP. I hope this information from my experience helped you. If you're interested in recommendations for your individual situation, you may contact us through our websites or call our offices to schedule a consultation. Thank you.